ऑल आर ग्रेट। सो आज हम अपना यूरिन एनालिसिस का सेकेंड वीडियो पढ़ेंगे। सो दोज हु हैव नॉट वॉच्ड द पार्ट 1 ऑफ यूरिन एनालिसिस, आई रिक्वेस्ट टू go and watch that first. So let's start our video, and today we will discuss about some other parameters. So let's get started. And you can always follow me on Insta, the labdoc27, and on Facebook my page is the lab physician. Please do follow me on Insta and Facebook. So where we have discussed all these parameters, and today we will discuss about specific gravity. So specific gravity, what do you understand by specific gravity? It is also called as relative mass density, and it mainly depends upon the amounts of solutes in the solution. So basically ये comparison हम करते हैं density of urine का against the density of distilled water at a particular temperature. The temperature is fixed and we compare the density of urine with the density of distilled water. Now the specific gravity of distilled water is always 1, and urine की normal specific gravity क्या है? 1.0032 to 1.0030, as I have discussed earlier also in the previous videos, and it mainly depends upon the state of hydration कि बंदा जो पेशेंट है वो कितना हाइड्रेटेड है, उस पर डिपेंड करेगी स्पेसिफिक ग्रेविटी. So it can be increased or decreased in various conditions. So it can be increased in, first of all, diabetes mellitus, in which there is glycosuria, nephrotic syndrome, there is proteinuria, fever and dehydration. And it can be decreased in diabetes insipidus, chronic renal failure and compulsive water drinking. Now there are many 2-3 methods for measuring specific gravity. One is urinometer method and another one is reagent strip method. So for us guys, reagent strip method is important. So in this method, the strip measures the concentration of ions in the urine, which correlates with the specific gravity. Now depending upon the ionic strength of the urine, a polyelectrolyte will ionize in proportion, and this will cause a change in the color of the pH indicator, that is bromothymol blue, and we will get the specific gravity. There is a famous cartoon that is I was stuck in traffic for 2 hours. On the way here, so I have my urine sample ready. The patient here is giving his urine sample to the doctor, so much quantity. Now let's move forward. Now the main and important part is chemical examination. We have discussed the physical examination up till now, and now we will start the chemical examination. So there are different methods, or we can say parameters जो कि हम chemical examination में measure करते हैं. इसमें हमारे पास pH, प्रोटीन्स, ग्लूकोज, कीटोन्स, बिलिरुबिन, बाइल सोल्ट्स, यूरोबिलिनोजन, ब्लड, हीमोग्लोबिन, मायोग्लोबिन, नाइट्राइट, ल्यूकोसाइट एस्ट्रेस, ये सब हम पैरामीटर्स जो हैं जो हम केमिकल एग्जामिनेशन में देखते हैं. सो ग्लैड यूरिन माई लाइफ, हियर इन दिस कार्टून इट इज यूरिन माई लाइफ. नाउ यूरिन डिपस्टिक एनालाइजर, it is a semi-automated machine which uses reagent strips to measure the different parameters of the urine. It is the ClinTech Advanced Urine Chemistry Analyzer. It is a semi-automated instrument that provides flexible productivity for busy clinics, healthcare practices and laboratories. So it is with thorough output of 7 seconds per sample, and it can able to process up to 500 tests per hour. The ClinTech Advanced Analyzers, it delivers high quality and reliable urine analysis results. You will see this analyzer in many labs. It is the most common analyzer used. Now the first parameter is pH. So pH we measure by reagent strip method in the urine dipstick analyzer. The test area contains the polyionic polymer bound to H+. On reaction with cations in urine, the H+ is released, causing a change in the color of the pH sensitive dye. That means when the test area containing the polyionic polymer, it bonds to the H+, and then on reaction with the cations of the urine, the H+ is released and it causes a change in the color, and we will get the desired result on the analyzer. So the normal pH is 4.6 to 8. It is a very important to remember for the exams. The normal pH of urine is 4.6 to 8 or slightly acidic, and it depends on diet, acid base balance, butter balance and renal tubular function. Now the acidic urine can be found in ketosis, diabetes mellitus, starvation and fever. UTI by E. coli and high protein diet can also cause acidic urine. Alkaline urine, it can be found in UTI infection by bacteria that split urea into ammonia, that is by Proteus or Pseudomonas, severe vomiting, vegetarian diet, old ammoniacal urine sample and chronic renal failure. In this pic you can see the reagent strip test, which has markings on it pH 5, 6, 6.5, 7, 7.5, 8 and 8.5. So I hope you are getting all these parameters and their mechanisms. Now let's move forward. Now second one is proteins. The normal quantity of protein in urine is up to 150 mg per 24 hours. Now if the proteins are increased, then we can say that it is proteinuria. Now there are different causes of proteinuria. First of all, which is, let me change the pen. So first of all, it is glomerular proteinuria. Second one is tubular proteinuria. Third one is overflow proteinuria and hemodynamic and post-renal proteinuria. Now there are different tests for detection of proteins in the urine. First of all, which is heat and acetic acid test, which is also called as boiling test. Second one, which we routinely do, is reagent strip test. Now, the mechanism of proteins measurement in the reagent strip is that it is coated with an indicator and buffered to an acid pH, which changes color in the presence of proteins. This is known as protein error of indicators. Now, the reagent area is impregnated with bromophenol blue indicator buffered to a pH 3.0 using citrate. Then there is protein adsorption to the dye, causing ionization and pH changes, leading to a color change, which is measured by the machine. Now, this color intensity which is measured, it is proportional to the protein concentration, making the test as semi-quantitative. Now, the reagent strip test is primarily reactive to albumin. Now, there can be false positive results or false negative. We have to remember the condition in which there is false negative. It can occur in the presence of Benz-Jones proteins, myoglobin, and hemoglobin. If there is overload proteinuria, in case of Benz-Jones proteins, and tubular proteinuria, it may be missed if only the reagent strip methods are used. So after the reagent strip method, it is always followed by sulfosalicylic acid, which is a confirmatory method. Although we do not do routinely, but it is a confirmatory method. And in cases where it can cause false positive results, it includes highly alkaline urine, gross hematuria, or contamination with vaginal secretions. So please repeat with me. False positive can occur in highly alkaline urine, gross hematuria, contamination with vaginal secretions. Now in this picture you can see that the grading of proteinuria on the reagent strip test according to the color change. And this is the sulfosalic acid test for the proteins. So if the proteins are negative, this color used, then trace, then 1 plus, which is up to 30 milligram per deciliter, then 2 plus 100, 3 plus 300 milligram per deciliter, and 4 plus more than 2000 plus milligram per deciliter. Now let's move on to the next slide. The third test is sulfosalic acid test. In this, we use the addition of sulfosalicylic acid to the urine causes a formation of a white precipitate if the proteins are present. It is a more sensitive test. Now, the definition of proteinuria, which is very important. Many questions are asked in the Viva. So, proteinuria is more than 1500 mg per 24 hours, which indicates a glomerular disease. If the proteinuria is more than 3500 mg per 24 hours, it is called as nephrotic range proteinuria. And in tubular, hemodynamic, and post-renal disease, the proteinuria is usually less than 1500 mg per 24 hours. Now, there is a term known as microalbuminuria. It is the urinary excretion of 30 to 300 mg per 24 hours or 2 to 20 mg per deciliter of albumin urine. Now, as we have discussed two methods, first of all reagent strip, and the second one is sulfosalic acid. So the differences between these are, first of all, principle. The reagent strip works on the calorimetric principle and the sulfosalic acid works on the acid precipitation method. The proteins detected are albumin in reagent strip, and sulfosalic can detect all proteins: albumin, Benz-Jones, hemoglobin, and myoglobin. Sensitivity is 5 to 10 mg per deciliter, and of this it is 20 mg per deciliter. The indicator used is color change, and here is turbidity. That it is a type of screening test and it is a type of confirmatory test. Now, microalbuminuria, as I have told you, it is excretion of 30 to 300 milligram of albumin per 24 hours. Now, what is the significance of albuminuria? Why are we discussing it is here? So, if the microalbuminuria is considered as the earliest sign of renal damage in the diabetes mellitus, that is diabetic nephropathy, and it is an independent risk factor for cardiovascular diseases in diabetes mellitus. So, these are the two significance of microalbuminuria, and the detection can be done by specific test because it cannot be detected on routine examination. The methods are, first of all, measurement of albumin creatinine ratio in a random urine sample, measurement of albumin in an early morning or random urine sample, and measurement of albumin in 24-hour sample. Now, this flowchart gives overview of proteinuria in the urine. So, if there is proteinuria, repeat reagent strip test or sulfosalic acid test. If it comes negative, then it is hemodynamic proteinuria like fever, heavy exercise, or earlier false positive test in cases of concentrated urine or alkaline urine. Now, if it comes positive, then we have to do examination of urine. Now, in examination of urine, if we get red cells, dysmorphic red cells or red cell cast, it is a case of acute glomerulonephritis. If we get white cells, white cell cast or bacteria, it is case of pyelonephritis. If we get white cells without white cell cast and bacteria, if there is absence of bacteria and cast, it is a case of interstitial nephritis. If we get granular cast or waxy casts, it is a case of chronic renal diseases. And if we get lipid in urine like oval fat bodies or fatty cast, it is a case of nephrotic syndrome. And if we get eosinophils, guys, if we get eosinophils in the urine, it is a case of drug-induced acute interstitial nephritis. It is a very important. If we get eosinophils, it is a case of drug-induced acute interstitial nephritis. So now let's move on. Now the third parameter that we are going to discuss is today is glucose. So the presence of detectable amounts of glucose in urine is known as glucosuria or glycosuria. Now the urine should be tested for glucose within 2 hours of collection. In this also we do a reagent strip test, which is a rapid, inexpensive and semi-quantitative test. In the past, this test was used for home monitoring of glucose. Now that it is replaced by the glucometers. And urine glucose cannot be used to monitor control of diabetes, since renal threshold is variable amongst individuals. And although urinary glucose value is also affected by the concentration of urine. Now, the test for detection of glucose. First of all, the basic test that we all know is Benedict qualitative test. Now, the principle of Benedict qualitative test for sugar in urine is that it converts the cupric ions, the blue copper sulfate plus sugar. If there is presence of sugar, in the presence of alkali and heat, it changes it to cuprous oxide, that is red, and cuprous hydroxide, which is yellow. The sensitivity of this test is 200 mg of glucose per deciliter. Now, it gives positive reaction with carbohydrates other than glucose, and it is also used as a screening test for detection of galactose, lactose, fructose, maltose, and pentoses in urine. Also for inborn errors of carbohydrate metabolism in infants and children. Now, the second one which we do is reagent strip method. It detects for the glucose. As Benedict cannot detect glucose, it can detect glucose, and it is more sensitive than Benedict qualitative test, and it is specific only for glucose. The sensitivity of this test is about 100 mg glucose per deciliter of urine. Now, the false positive test, it can be in oxidizing agent, bleach or hypochlorite used to clean urine containers, and which oxidizes the chromosome directly. In the cases of false negative, we can get in if there is large amounts of ketones, salicylates, ascorbic acid, and severe E. coli infection, because of catalyst produced by the organisms in urine inactivates the hydrogen peroxide. Now, the principle of reagent strip test. There are two stages, stage 1 and stage 2. In stage 1, if the glucose reacts with oxygen in the room air in presence of glucose oxidase, it converts into the gluconic acid plus hydrogen peroxide. Now, in stage 2, the hydrogen peroxide reacts with the chromogen. In the presence of peroxidase enzyme, it converts into the oxidized chromogen, which is blue plus water, which is measured. And as I already told you, the sensitivity is 100 mg glucose per deciliter of urine. And this is the Benedict test grading. If the color is blue, then it is nil, green, trace, brown, 2 plus, yellow, orange, 3 plus, brick red, 4 plus. And in cases of reagent strip test, it is color wise negative 100 mg per deciliter, 250, 500, 1000, more than 2000. So that's all guys for today. I hope you guys get the concepts and the mechanism of urine parameters, and don't forget to like, share, and subscribe my channel for upcoming videos. Thank you, bye bye, and take care.